This medication helps to relieve symptoms caused by excess stomach acid, such as stomach upset, heartburn, and acid indigestion. It can also help with symptoms of extra gas, like belching, bloating, and discomfort in the stomach. The simethicone in this medication helps to break up gas bubbles in the gut, while the aluminum and magnesium antacids work quickly to lower the acid in the stomach. It works only on existing acid in the stomach and does not prevent acid production. This medication may be used alone or with other medications that lower acid production. It is important to carefully read the package instructions before using this product to ensure it is right for you. If you have any questions, ask your pharmacist for guidance. When taking antacid 200 mg, 200 mg, 20 mg/5 ml oral suspension, it's best to take it by mouth after meals and at bedtime as needed. Make sure to follow the directions on the product packaging or as directed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you're using the chewable tablets, be sure to chew thoroughly before swallowing and then drink a full glass of water. If you're using the liquid form, remember to shake the bottle well before pouring each dose and measure carefully using a medication spoon or cup. Refrigerating the suspension may improve the flavor, but do not freeze. The liquid form works best if taken without other fluids, although you can mix your dose with a little water if needed. It's important to note that this product may interact with other medications, such as digoxin, iron, pazopanib, tetracycline antibiotics, and quinolone antibiotics like ciprofloxacin, preventing them from being fully absorbed by your body. Be sure to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If your acid problems persist or worsen after using this product for 1 week, or if you think you have a serious medical problem, seek medical help right away. And if you're using this medication regularly on a daily basis for more than 2 weeks, it's important to ask your doctor whether this is the right medication for you. Some common side effects of antacid 200 mg, 200 mg, 20 mg/5 ml oral suspension include nausea, constipation, diarrhea, or headache. If any of these effects persist or worsen, it's important to seek medical advice. The magnesium in this product can cause diarrhea, but using an antacid that contains only aluminum can help control it. However, the aluminum in this product can also cause constipation. To minimize constipation, make sure to drink plenty of fluids and exercise. It's important to note that if your doctor has prescribed this medication, they have determined that the benefit to you outweighs the risk of potential side effects. While many people using this medication do not experience serious side effects, it's crucial to be aware of potential symptoms and seek medical attention if necessary. In some cases, aluminum-containing antacids can bind to phosphate in the gut, leading to low phosphate levels. This is more likely if the medication is used in large doses and for a long time. It's important to inform your doctor if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Additionally, it's important to seek medical help if you experience serious side effects, such as dizziness, fainting, slow/shallow breathing, slow/irregular heartbeat, mental/mood changes, or severe allergic reactions including rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Remember to seek medical advice if you have any concerns about the medication. Before using this product, it's important to talk to your doctor or pharmacist if you have any allergies to aluminum hydroxide, magnesium, or simethicone, as this product may contain inactive ingredients that could cause allergic reactions. If you have health problems such as frequent alcohol use, dehydration, kidney problems, or phenylketonuria, PKU, it's important to consult your doctor or pharmacist before using this product. If you have diabetes or are pregnant, it's important to discuss the use of this medication with your doctor. Additionally, if you are breastfeeding, consult your doctor before using this medication. It's important to always follow the guidance of your healthcare provider and pharmacist when using this medication. When taking antacid 200 mg, 200 mg, 20 mg/5 ml oral suspension, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Some products that may interact with this drug include phosphate supplements, such as potassium phosphate, and sodium polystyrene sulfonate. Antacids can also interfere with the absorption of many other drugs, so it's crucial to check with your pharmacist before taking antacids with any other medication. In terms of the daily dosage and optimal timing, it is best to follow the instructions provided by your doctor or pharmacist. Antacid 200 mg, 200 mg, 20 mg/5 ml oral suspension can provide relief for heartburn and acid indigestion when taken as directed. Always consult with a healthcare professional for personalized advice on the best time to take this medication. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the United States, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to keep all your medical and lab appointments. In addition to taking this medication, making some lifestyle changes can also help improve its effectiveness. This can include participating in stress reduction programs, quitting smoking, limiting alcohol intake, and making dietary changes such as avoiding caffeine, fatty foods, and certain spices. It's a good idea to talk to your doctor or pharmacist about any lifestyle changes that might benefit you. If you forget to take a dose of this medication on your regular schedule, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. When storing antacid 200 mg, 200 mg, 20 mg/5 ml oral suspension, keep it at room temperature away from light and moisture. You can also store the liquid product in the refrigerator to improve the taste, but do not freeze it. It's important to keep all medications away from children and pets and avoid storing them in the bathroom. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.